Hello, everyone. My name is Celso Bandeira. I'm a head and neck surgeon and a professor from uh, Humanitas Medical School from São José dos Campos, Brazil. And I'd like to talk about health incidents during on-site mission, on-site and outside. And what's wrong? Okay. The topics that I would like to talk is about the hypothermia and heat stroke, fainting in hypothermia, choking, bees and wasps accidents, anaphylactic shock, and many kinds of other injuries that the analog astronaut can be done. Well, the information presented is based in the national and international consensus that reflected the practice of evidence-based medicine. Medical decisions are critical for determining the appropriate procedures. And in case of great severity or difficult to management, the department must be referred to specialized medical service. Well, when you are talking or are planning to make a mission, I think the preparation is very specific, and the analog astronaut must be think about the assessment of predictor weather condition, clothing, ability to keep warm, water supplies, communications. I know that in Habitat Marte we don't have a problem about a cold weather or hypothermia, but I think it's important to say something about. First, I would like to say about the hypothermia is the one problem in the spaces or in the place, in the place when you have a great temperature. And hypothermia is general term of heat exhaustion and heat stroke. It's an excessive loss of body fluid through perspiration. And it's too important, early recognizing and medical attention is essential. The symptoms, the signs and symptoms, I think the most important is the faintness and guidance. First, rapid pulse and breathing, and confusion and irritability. That's the more dangerous is this situation. Another symptoms like nausea, muscle cramples, and heavy sweating is the other signs that we can see. The action are we need to think about to move this participant to a cold place with a fresh air, losing his or her clothing to remove. And we can encourage the person slowly to drink some water and apply ice packs if we want. Heat stroke is more dangerous. It's aggravation about hypothermia. And you can see in sometimes when the body temperature is 40 degrees Celsius or more, and we can see patients with a rapidly or boundary pulse, confusion and irritability. It's important, and in some conditions, loss of consciousness. In this case, if the participant is unconscious, place him in the lateral position and check if the patients are breathing, checking the airway and pulse. And if it's necessary, we can start the CPR protocols. This situation is more dangerous, and we think about this, it's an important condition. Fainting, it's a situation when the patient may lose consciousness, or if there's temporary drop in the blood supply to the brain. It's caused by specifically when they stand still for too long, especially in a hot place, like a staff room, or in a hot day in an extravehicular activity. That's signs and symptoms. You can see the patient was paid, the astronaut is paid, cold and clammy skin, and loss of consciousness. In the action, it's important to lay the person down with the feet raised, check the breathing and pulse and checking if it's normal, and it's important to check if there are any injuries or illness that can explain or can know about fainting. And it's important to encourage the person the rest of the while before moving until he's feeling good. Hypothermia is another condition, but I think it's important in some place there is extreme cooling. It's not specific from our habitats, but it's important. Hypothermia after the loss of the body surface heat, there is a cooling of deep tissues in organs, and this is the problem about the participants of the mission. Hypothermia, like signs and symptoms, I think the most important is blurred vision, slowing of mental and physical alertness. It's important to see the patients do not attempt to warm the victim quickly by using an electric blanket or hot water. It's not specific for here in our place. I think hypothermia, it's important if you can imagine our participants in the outside, sometimes in the cold weather. It's not too common, but I think it's important. Like action, it's important to move the casualty to a warm and dry shelter if it's possible. Choking is an important situation from everywhere, and specifically in we are talking about the analog emission. But choking is an uncommon but potentially treatable cause of accidental death. It's associated sometimes with eating, when the patient can be, they have an obstruction, and it's important to recognize the airway obstruction in this situation by foreign bodies that can be cause either mild or severe airway obstruction. The Heimlich maneuver is too important, but before you can see if the patients are choking, and it's important to ask and see what's the patient answer, if there is a victim unable to speak, or they can respond by nodding. And sometimes other signals more dangerous, like victim struggling or unable to breathe, and breathing sound wheezy, a noise, a different noise. If the victim shows signs of mild airway obstruction, it's important to encourage him to continue coughing. And if the victim shows signs of severe airway obstruction, it's important to continue to instruct the victim to cough. In situations that patient can't breathe, it's important to give up to 5 back blows by doing the following. standing to the side and sliding behind the victims, and support the chest forward with one hand, so that we can disallow the obstruction object if you can make the blows. It's not necessary to make 5 blows. You can make just one and A and C if the patient doesn't choke enough. If the patient don't have a briefing, it's important to see and recognize, and we need to see the patient to relieve the airway obstruction and give the 5 abdominal thrust. We can make this, stand behind the victim and put both arms around the upper parts of his abdomen and lead the victim forward. After you plant your fist and place it between the umbilicals and bottom end to the sternum. Now you can grasp this hand with other hand and pull sharply inwards and upwards, and repeat as I think is necessary. Here is like a fluxogram. That what you need to do if you have a severity choking. If you are an ineffective cock and the patient is unconscious, it's important to start CPR maneuvers. But if they are conscious, it's important you can make the black balls and 5 abdominal thrust, and you can intercalate both maneuvers. If there's a mild airway obstruction, is an effective cock, it's important to encourage the patient to cough. Well, bees and wasp accidents, it's the other kind of situation that some people suffers allergic reaction and they have a swelling and itchiness on the body. It's sometimes in more dangerous situation, the patient have a constricted throat and difficult to breathe. The action, if the bee sting is involved, it's good to remove the sting by brushing, and do not squeeze the poison, such as a pulling on the barb. Wipe the area and apply a cold compress. The cold compress can make a vasoconstriction, and the allergic poison can make less absorption. When the situation is more dangerous, we can be anaphylactic shock. It's a severe acute allergic reaction. And in this kind of anaphylaxis, there is a system by the release of histamines, which cause massive peripheral vasodilatation and plummeting blood pressure. The dilated capillaries also become leak and fluid leaks, and surrounding tissues cause swelling. This is a common, very accident around the face, and it's if this made, because also happens in the throat and cause difficult to swallowing. And in Australia, they commercialize, we don't have here in Brazil, the adrenalina injectable is a specific exception of the regulation government to administration injectable medicine by the patient, by the individual, or some people who will be here. It's important to realize, even after the administration of adrenaline anaphylaxis, go to the medical urgent to receive some cares. Specifically in analog emission from Habitat Marte, Lunar, and Lava Cave, we can see some kinds of plants. There's important to a possibility to allergic reaction and a superficial skin injuries. One example is a macambira. Macambira is a kind of a bromelia, and that you can see in the picture. It's a plant that have many kinds of how can I say? I don't know the spines.
Spikes.
Spikes. Okay, thank you. And it's very. They can make allergic reactions and skin injuries if you contact without appropriated clothes. The other plant is important. It's a cactus. It's a kind of scrubs. You can see many kinds of cactus, and in this region about in this place, Habitat Marte, Habitat Lunar in Lava Cave, you can see too many another kind of a great kinds of cactus, but this two most common cactus. Urtiga is another plant that can cause irritation skin, and it's another problem if you are many EV extravehicular mission. Oh, what's wrong? Okay. In terms of kind of different animals, one of the problem is snakes and the bites of snakes and scorpions and others. Well, if you are suspect about the bite of snake, it's important do not waste time trying to identify the snake. It's not important to know who is the snake. It's important to go and apply first aid immediately. Inconscience and breathing difficult can develop quickly. The signs and symptoms, you can see the puncture marks in the skin. And when the time is coming, you can make a nausea and vomiting, diarrhea, headache, double vision, inconscience, and this situation show that condition is more dangerous. It's important to not apply a tourniquet or restrictive bandage in the member, because the poison it can make a worse situation. And important to not cut or cauterize the snake bite. And it's important to seek medical aid urgently, because there is a medication and something to do to make aid for this patient. Here is the picture that Dr. Julio showed in his presentation, that she showed a snake inside in the soil, and you can see the difficult to see this kind of a snake. Here you can see it's interesting. The scorpion, I don't know if we don't have in that place, but this kind of Tiltus stimulus is a species of scorpion distributed in the Caatinga. And the most problem of this kind of accident is in a child. because the child, the poison is too dangerous, and the child can be deaf. But in adults, the most problem is pain. It's very hard. It's important pain if you are bite about scorpion. Other condition is burns. Burns are caused inside. I think inside of it can possible to burn inside of intravehicular activity, and they caused by heat from flames, electricity, lighting is outside, or chemical products like acid or alkaline substance. And outside is important too. We think about the sunburn that I can see later. And the scalds are caused by a boiling liquid. It's different from the other kinds of burns. And this is important because it's called the distribution of the liquids. They more important. It's important because you can see big areas caused by boiling liquids. For action, we can remove the casualty from dangers and source of heat if you can do without becoming a casualty yourself. It's important if the casualty is unconscious, place him or her in the lateral position and check the airway, breathing, and check pulse. And if it's necessary, we can start the CPR maneuver. Another action, we can cool the burn area with a cold, but not ice water. It's important to relieve the pain, and you can make lower edema, okay? And it's important to cover the burn with a sterile and not adherent dressing. And it's important to not use ointments, lotions, or some kinds of cream. Just clean with the physiologic liquid and making well, for all except the mineral burns and scalds, seek medical aid immediately. For the minors, just this, I think it's okay. Sunburn. Well, the best prevention, the best to avoid the sunburn is prevention. It's important to reduce. It's important to avoid in some conditions that you are in the extravehicular activity, and sunblock. It's important. It's important to do some activities not in the beginning of the morning or after the lunch, and not expose in the time of the sun is too high. Dislocation and fractures. Any joint may be dislocated, and as dislocation are frequently excruciating, painful, and must be dealt with carefully. Here you can see a kind of dislocation, and the problem is the pain. The most problem is this situation that patient can't move, and it's important to support in a position that could be a comfort for the patient. It's important to immobilize the joint in the body in a position which it was found. It's important to do not manipulate it. If there is no circulation beyond the injury, In this case, very gentle straightening may be attempted. And after, if a distal deficit cannot be correct, the situation must be treated in a surgical emergency and urgent medical help. The most important of dislocation is the vascularization place. Fractures, we can classify fractures in open, where there is a wound associated with the fractures, or closed, where there is no skin lesion. The importance of this, the wound, the open fractures can increase the risk of bleeding and infection. Signs and symptoms, the most important is pain, deformity, hematoma, loss of function, and crepitus. Crepitus, you can make a differential diagnosis about the other situation that I told, because you can listen a sound which results from the broken ends of the bone rubbing together. The action, it's important to you split a fracture will be provided because this is reduce the pain, and generally speaking, the first aid will not have a sex, and it will be necessary to improvise. If you don't have something to splitting, you can improvise. And one form, if there is a fractures in the leg, for example, you can injure the legs, immobilized by bending the uninjured leg the other side. You can immobilize too. Bleeding. Bleeding is a problem. It's a great problem in some situations about analog emission, because there are many causes: cuts, wounds, blunt trauma, and penetration injuries. And you can see external bleeding or internal bleeding. Internal bleeding, it's a dangerous situations and can be and must be treated effectively in a hospital. But bleeding, simple supine bleeding can be trusted just make you can make how can I say, or just to make well, it's important when you are stay with an injury with bleeding. It's important to use gloves and tourniquets. You can use, but just for control the severe bleeding, because tourniquet there is a problem of ischemia of the member, and you can use, but it's very specific situation, and you are a great blood, external great blood. A casualty with severe bleeding should ideally be lying down with legs elevated to improve circulation to the core organs, and the patient must be rapidly go to the hospital. Split wounds were appropriate to reduce movement. It's interesting. You can immobilize this member to reduce the bleeding. Here we can see some kinds of bleeding, small bleeding like just abrasion, and you just clean with the water and put a bandage in place to avoid the infections. Small lacerations, you can clean off after you can clean, and you can just make a bandage in place. But if you are laceration, more extensive, you can try to bring one side together and apply a suitable dressing and go to the hospital to the new evaluation. Bandage and split, it's important if you applied too tight, many pairs the circulation. It's important to use C, and all the time you're evaluating your speech. Well, when I said internal bleeding action, it's a problem, and you must to monitor vital signs. The patient need to stay without food, not to eat or drink. And any trauma victims should be suspect or have internal bleed if sign of shock appearance. In this case, the speed of ascent and the casualty should be dispatched to the hospital to receive. Nose bleeding, it's a very common situation. You can see in the place, there is a hot place. There is sometimes they occurs for no apparent reason. And the action just to have the person sit down and stay for about 10 minutes. You can lean slightly forward and hold his on her nostrils together. And the person should not blow the nose for the several hours after bleeding. And if the bleeding persists, we need to see the doctors. It's important, it's not common, but you can see in trauma situation, the inconscientiousness and a flow of pain fluid mixed with blood can indicate a heat injury. You can see the base fractures of the skull. This can be serious, and the patient must go to see in an emergency place immediately. To immobilization and transportation, it's important to control external bleeding. It's important you put a sterile compressive dressing and consider a brief and cleaning resin, open once with a solution, saline solution. After peripheral pulse and perfusion sensibility and mobility is important to you evaluate this situation. When are you making immobilization for transportation, it's important to return to the anatomical position, but it's except if in the presence of significant pain or resistance to repositioning. It's important to evaluate after you return in an anatomical position. You see if there is a peripheral pulse or perfusion sensibility and mobility after you make immobilization. And finally, drawing is a dangerous situation. And I think the most important to avoid drowning is it's a prevention. It's important to the participants learning to swim, learning basic rescue of resuscitation procedures. Do not attempt to rescue anyone to deep water if you are an inexperienced swimmer. Sometimes you have extravehicular activity and you can stay in a place that you can swim. Action, this is important. Check the airway. It's the most important because this patient died about asphyxia. And it's important to check and to check his breathing. If it's not breathing, it's important to start the CPR and go to this patient immediately to the hospital. This is my reference. I'd like to apologize about my English. It was my first presentation in English, and thank you very much for all.